Hey! Is it possible to be pre-diabetic and not even know about it? Sadly, 1 in 3 people watching this video in the United States is pre-diabetic, and about 90% of them have no idea. Today, there are 96 million pre-diabetic Americans and counting. Your body sends warning signs before this condition turns into full-blown type 2 diabetes. And in today's video, we'll be discussing these symptoms. Is feeling hungry and thirsty all the time dangerous? What about blurred vision? We're talking all that and more. But first, what exactly is prediabetes? Diabetes doesn't happen in a day. It gives you a window where you can stop the progression of this disease. Prediabetes is the phase before you become diabetic, and it can go undetected for years. If you just ignore this condition, you may have an increased risk of developing type 2 diabetes, heart problems, and stroke. These are much more difficult to live with than just prediabetes, so you might want to consider this as an opportunity to prevent deadly complications. If you are over 45, you need to be very careful about what you eat. Staying active and maintaining a healthy weight should be top priority. If diabetes runs in your family, you would be at high risk. Gestational diabetes, high blood pressure, or smoking bring you closer to diabetes. You must get your blood work done every 6 months. There are a couple of tests that are clear-cut indicators of prediabetes. If your fasting blood glucose levels are less than 70 milligrams per deciliter, then you're in the safe zone. If it falls between 100 to 125 milligrams per deciliter, then you're in the pre-diabetic range of blood glucose. Above 125 and you are diabetic. At this point, if you want to get it under control, you may need the help of medicine. There's another test called HbA1c that can measure average blood sugar over the last 3 months. Normally, it'll be below 5.7%, but pre-diabetics will be between 5.7 to 6.4%. The level shoots above 6.5 in type 2 diabetes. But can pre-diabetes be detected before getting a blood test? Yes. If you're feeling exceptionally tired without doing much physical work, it could indicate that you're pre-diabetic. Feeling low on energy or tired even after sleeping for long hours could be because of insulin resistance. Pre-diabetes does not allow optimal use of insulin. It increases glucose levels in the blood, which is why your cells fail to get enough glucose from the blood. When your vital organs are supplied with less energy, they cannot function fully, and you won't be able to seize the day like you want to. When you start feeling tired, there's another sign that you should pay attention to. Have a good look at your skin. Do you see thick, velvety patches on your elbows, knees, neck, armpits, or knuckles? If yes, then the dark skin could be underlying prediabetes. Doctors call this condition acanthosis nigricans. Generally, it's associated with polycystic ovarian syndrome, but that's not a rule of thumb. Check your skin folds and groin. Even if you try scrubbing these areas, they will not look clean. The warty or unusual appearance could indicate too much insulin circulating in the blood. Your doctor might prescribe skin lightening creams and lotions, along with a few medications to get rid of this condition. Also, start eating vegetables, fruits, avoiding sugary drinks, and exercising in the meantime. Sometimes you may get them from your parents or by using steroids and oral contraceptives. So don't jump to conclusions immediately. Try to get to the root cause with the help of your doctor. Apart from this, have you been feeling a little itchy all over? When you have elevated blood sugar, your overall immunity also takes a back seat. White blood cells are the first line of defense against any infection, but the high sugar does not allow these fighter cells to perform to their full potential. That's why when you get a skin infection, your body can't fight it off well enough and you'll need the help of medication. If you're not vigilant in reducing your blood sugar, skin infections could keep coming back. Are your bruises and cuts taking forever to heal? Then high sugar levels might have hijacked your body's clotting system as well. Hyperglycemia or elevated blood glucose interrupts the free flow of blood reaching these cuts and wounds. Your blood carries clotting factors and platelets that help stop bleeding and heal the wound. But due to poor circulation, the required amount of these wound healers never reach the actual site. That's why those shaving nicks take a longer time to heal. Do you see streaks of blood every time you brush your teeth? Red, swollen gums can quickly point to rising blood sugar levels. If you are a pre-diabetic, your saliva will also have higher sugar. It creates a conductive atmosphere for harmful bacteria and germs. Plaque instantly starts growing on your teeth and gums, leading to loose teeth, bad breath, decay, and inflamed gums. So when the bristles of the brush or the thread of the floss touch the gums, you start bleeding. The blood flow also becomes sluggish. The blood vessels can't remove waste fast enough from the tissue and puts the gums at risk of infection. To see the next symptom, you have to have great vision. Prediabetes can affect your eyesight. High blood sugar causes ocular changes called diabetic retinopathy. Some of the early signs include a change in the shape of the lens. It generally swells up and your vision is offset. Higher blood sugar levels can also cause leaky blood vessels, pale fatty deposits on the retina, damage to nerve tissue, and macular edema. The blurry vision can arise immediately after eating carb-rich or sugary food. Thankfully, these symptoms can be completely reversed by changing your diet. Speaking of diet, do you feel famished despite having a big meal? Polyphagia, or excessive urge to eat, is closely associated with prediabetes. So you may find yourself in front of the fridge rummaging for snacks or treats after your food. As your body becomes insulin resistant, it does not allow the cells to take up glucose from the food. Glucose is converted into energy. But as there is no energy nor any glucose in the muscles and tissues, your brain signals that you're hungry. And that is why you start eating more food. Elevated blood sugar levels do not give you a feeling of satiety. When the glucose goes up, the amount of insulin circulating in your body also rises. It converts all that sugar into fat. Your BMI will also increase. Excessive eating and too much insulin is a double threat to weight gain. But if you reduce your body weight by 7% with exercise for 30 minutes every day, it will stop you from getting type 2 diabetes. Do you spend a lot of time at the water cooler or just keep buying more water bottles? You may feel like washing down that extra food with extra water. You can drink all the fluids, all the drinks, and still be parched. Your insatiable thirst is because of excess blood glucose. Your body will want to dilute the blood with fluids as it is super concentrated with sugar. It tries to draw in the fluids from tissues. Your muscles and other organs will always be dehydrated till you balance out the sugar levels. You may have a dry mouth and tongue that's difficult to get rid of. Doctors call this condition polydipsia. But guess what will happen when you drink all that water? That's right, your bathroom trips will increase. You can feel the urge to urinate more after you've had your morning espresso or tea. These drinks are potent diuretics and are known to pull water from your body, but you may get a similar sensation when your blood glucose is elevated. It's called polyuria in medical terms. Your kidneys do not allow any nutrients to pass easily, so it starts a process of reabsorption. Glucose is a nutrient for your body when it's in the normal range. The kidneys cannot absorb glucose beyond a limit. They'll want to let go of all the excess. But glucose does not pass through urine on its own. It needs a carrier to help it get out of the body. Water does just that. That's why you feel the urge to urinate literally every hour. You now feel thirsty and drink more water. If you drink juice, the sugar in it will make you more dehydrated and you'll want to pee more. Before even realizing, you start a vicious cycle. All the excess sugar may even cause urinary tract infections at times. Moving on, do your hands and feet become numb? So much so you can't even feel them? Your hands and feet can also give you important clues about your sugar levels. Keep an eye on funny sensations like tingling, numbness, or burning in your extremities. This is called diabetic neuropathy. It affects the nerves of your extremities, and if you're not careful, you may develop ulcers on your feet. Eventually, you may even lose your foot. Hard to imagine that an irrelevant symptom like pins and needles can make you lose a foot. Studies have shown that about 6 to 51% of adults can have peripheral neuropathy if they do not control their sugar levels. Excessive sugar also spells trouble for your bones. When the numbers on the weighing scale start increasing, your bones, especially knees and ankles, have to bear the brunt. Studies have shown that you can also develop osteoarthritis with high blood glucose levels. About 52% of adults with higher sugar are susceptible to joint problems. It can happen to anyone from 18 to 64 years of age. A unique amalgamation of exercising and healthy eating will strengthen the joints from within. Want to know more? Let's keep the conversation going with a couple more bone-related videos, shall we? Watch 11 ways for you to build healthy bones, or 5 ways to strengthen your knees, cartilage, and ligaments. Go ahead, click one, or better yet, watch both and learn more about how to strengthen your bones. Do you have any symptoms of prediabetes? Let us know in the comments below.